A very good morning to my lecturers and my fellow friends. I, Kaniyamdan Kartigesu, today will discuss about hepatitis C. So, what is hepatitis C? Hepatitis C is a liver disease caused by the hepatitis C virus, HCV. The virus can cause both acute and chronic hepatitis, ranging in severity from a mild illness lasting a few weeks to a serious, lifelong illness. Hepatitis C is a major cause of liver cancer. Hepatitis C virus is a blood-borne virus. A significant number of those who are chronically infected will develop cirrhosis or liver cancer. Epidemiology of hepatitis C. This virus is found worldwide. Globally, an estimated 71 million people are living with chronic HCV infection. In 2016, WHO estimated that approximately 399,000 people died from hepatitis C, mostly from cirrhosis and hepatocellular carcinoma, primary liver cancer. The most affected regions are Eastern Mediterranean region and the Eastern European region. The prevalence is considerably higher, more than 1% in some countries. Eastern Europe 3.3% in Russia, 2.2% in Latvia. Africa 6.3% in Egypt, 7.0% in Gabon. Middle East 3.0% in Syria. Southern and Eastern Asia 3.8% in Pakistan, 6.4% in Mongolia. Properties of the causative agent. The hepatitis C virus is a small enveloped single-stranded positive sense RNA virus. It is a member of genus Hepativirus in the family Flaviviridae. There are 7 major genotypes of HCV which are known as genotypes 1 to 7. The genotypes are divided into several subtypes with number of subtypes depending on the genotype. In the United States, about 70% of cases are caused by genotype 1, 20% in genotype 2, and about 1% by each other genotypes. Genotype 1 is also the most common in South America and Europe. The half-life of the virus particles in the serum is around 3 hours and may be as short as 45 minutes. In an infected person, about 10 to power 12 virus particles are produced each day. In addition to replicating in the liver, the virus can multiply in lymphocytes. In this slide, I have added some things already. So here we can see the specific genotype 1b in the genotype are the most commonly seen in the United States, Europe, Japan, and Taiwan. Genotypes 1b and 1a, also common in United States, are less responsive to interferon therapy than other HCV genotypes are. Transmission of hepatitis C virus. This hepatitis C virus transmits through blood. So, high-risk activities include blood transfusion, organ transplants, sharing needles, syringes, or other equipment to prepare or inject drugs, needle-stick injuries in healthcare settings, being born to a mother who has hepatitis C, sharing personal care items that may have come in contact with another person's blood, such as razors or toothbrushes, having unprotected sex with a person infected with the hepatitis C virus, Getting a tattoo or body piercing in an unregulated setting that uses non-sterile instruments contaminated with hepatitis C virus. Hepatitis C is not spread through breast milk, food, water, or causal contact such as hugging, kissing, and sharing food or drinks with an infected person. So the clinical features of this hepatitis C virus. Many people with hepatitis C virus are commonly asymptomatic. All ages affected and both sexes affected equally. Severity vary variably. Incubation period 15 to 660 days. Constitutional symptoms will appear: anorexia, nausea, vomiting, fatigue, malaise, myalgias, headache, photophobia, pharyngitis, cough, and coryza. Onset of jaundice is observed by 1 to 2 weeks after the appearance of constitutional symptoms. Dark urine and clay-colored stools may be noticed from 1 to 5 days before the onset of clinical jaundice. The diagram below shows dark urine and the clay-colored stool. With the onset of jaundice, the constitutional symptoms usually diminish, but in some patients, mild weight loss 2.5 kg to 5 kg is common and symptoms may continue during icteric phase. The liver become enlarged and tender, pain and discomfort in the right upper quadrant. Infrequently, patients present with a cholestatic picture. Extrahepatic biliary obstruction, splenomegaly, and cervical adenopathy are present in 10 to 20% of the patient with acute pancreatitis. Few spider angiomas may appear during icteric phase. The laboratory diagnosis of hepatitis C. The first diagnostic tool we are using is enzyme immunoassay (EIA), a serologic test to detect HCV antibodies. Antibodies are produced when hepatitis C virus are present in the blood. They usually show up about 12 weeks after infection. Results: non-reactive or negative if you don't have hepatitis C, but if you've been exposed in last 6 months, you'll need to be retested. Reactive or positive: you have hepatitis C antibodies and you've been infected at some point. However, you still need another test to make sure. If the antibody test is positive, the number of viral RNA genetic material from HCV particles are measured in the blood. They usually show up 1 to 2 weeks after an infection. Recombinant immunoblood-assay (REBA), a target amplification technique to detect HCV RNA. Polymerase chain reaction (PCR), a positive test confirms HCV infection. The recommended testing sequence for identifying current HCV infection: when HCV antibody is negative, non-reactive, that means you are not infected and there is no HCV antibody detected in your blood, but you are still susceptible to get any infection. If your HCV antibody is positive, which is reactive, may be due to the current, past or result or false positive result, and your HCV RNA is not detected by the PCR or ribo. That means there's no current HCV infection and additional testing is appropriate. If your HCV RNA is detected by the PCR, that means you are current HCV infection. You are having current HCV infection and you will be taken care by the hospital. For the non-reactive group where there is no HCV antibody detected. There might be any exposure within prior with 6 months or other issues, so there should be an additional follow-up for these people. So the prevention and control of the hepatitis C virus. Vaccine. There is no approved vaccine to protect against this hepatitis C virus. A combination of harm reduction strategies such as the provision of new needles and syringes and treatment of substance use decreases the risk of hepatitis C in intravenous drug users by 75%. Medications. Approximately 90% of chronic cases clear with treatment. Treatment with antiviral medication is recommended in all people with proven chronic hepatitis C who are not at high risk of dying from other causes. The people with high risk complication risk should be treated first with the risk complication based on the degree of liver scarring. The initial recommended treatment depends on the type of the hepatitis C virus. If the person has received previous hepatitis C treatment and whether or not a person has cirrhosis. Direct acting antivirals DAAs may reduce the number of infected people. A research in 2011 shows that uh, a combination of sofosbuvir and velpatasvir in one trial resulted in cure rates of 99%. Surgery. Cirrhosis due to hepatitis C is a common reason for liver transplantation through the virus. Usually 80 to 90% of cases recurs afterwards. Infection of graft leads to 10 to 30% of people developing cirrhosis within 5 years. Treatment with pegylated interferon and ribavirin post-transplant decreases the risk of recurrence to 70%. Antiviral medication was useful in graft became reinfected. Alternative medicine. Several alternative therapies are claimed by their proponents to be helpful for hepatitis C, including milk thistle, ginseng, and colloidal silver. However, no alternative therapy has been shown to improve outcomes in hepatitis C, and no evidence exists that alternate therapies have any effect on virus at all. So before we come for a conclusion, the WHO response. In May 2016, the World Health Assembly adopted the first global health sector strategy on viral hepatitis 2016-2021. The strategy highlights the critical role of universal health coverage and sets targets that align with those of Sustainable Development Goals. The strategy has vision to eliminate viral hepatitis as a public health problem. This is encapsulated in the global targets to reduce new viral hepatitis infections by 90% and reduce deaths due to viral hepatitis by 65% by 2030. Actions to be taken by the countries and the WHO Secretariat to reach these targets are outlined in the strategy. For the World Hepatitis Day for 2019, WHO is focusing on the theme Invest in Eliminating Hepatitis to highlight the need for increased domestic and international funding to scale up hepatitis prevention, testing, and treatment services in order to achieve the 2030 elimination targets. Thank you very much. And this is my references.